everyone. Welcome back to the show. We have been looking a lot at different individuals so that you guys can not only get healthy, but you can start improving your lives in different ways. And you all know how I feel about the pharmaceutical industry. So I figured we would bring you through Dr. Mike Hart, a dear friend of the show, somebody who has been helping to change people's lives in Canada for the better through the medical practice. We thought we would bring you as a recommendation, Dr. Josef Witt-Doerring, who is out in the United States doing some incredible work. He is a board certified psychiatrist and the leading expert in psychiatric drug side effects and withdrawal. And he is the CEO and medical director of the Tapering Clinic, where he oversees all different types of individuals who are experiencing complex withdrawal symptoms. So thank you so much for being here. And thank you so much for doing the work that you're doing, more importantly.
Thanks for having me.
Yeah, it's always fun to have some medical individuals on the show who are not paid for by Pfizer.
They can be hard to find.
Nowadays, They are super hard to find, my friend. But you're not from America, I can gather by the accent. It looks like you've immigrated over, yes?
Yep. Yeah, I grew up in Sydney, Australia. I've been over here for like 10 years.
Still got that accent though, huh?
Yeah.
Why don't you tell everybody a little bit about yourself and how you got into this type of work? Because it is very much outside of the traditional medical world, which is, I mean, I've worked with enough psychiatry now to know that we put you on the drugs. We don't take you off of the drugs. So what changed for you? What made you want to go down this route as a medical practitioner?
So, I mean, I started out as like a bread and butter, I guess, pill mill type psychiatrist. But when I was in my residency, the thing that struck me, and I wonder why this doesn't stick out to other people, is that it just simply doesn't work very well. Because what I was noticing in my residency was we would put people on medications. They would have they would work, maybe for like 6 months, 12 months, and then they would need a higher dose, and then they would need a higher dose, and then they would be maxed out. And eventually they would say, I can hardly feel what this drug is doing, or the effect is hardly there. And then they would get on another drug, and then they would go through that cycle. And I started just seeing patients getting worse. They weren't really improving with this model. And I would talk to my attendings and say, well, this doesn't really make sense, that these are long-term solutions. And they'd say, don't worry about it, safe and effective, approved by the FDA. And they would kind of explain away the lack of improvement in these patients by saying, mental illness is mysterious. It morphs, it changes, they become treatment resistant. And so I wasn't able to accept that. And so I decided I wanted to study psychiatric drug research and clinical trials. I ended up working for Johnson & Johnson's pharmaceutical branch, Janssen, doing a fellowship in clinical, in psychiatric drug design. I then went to the FDA and then back into the pharmaceutical industry a few more times. And essentially what that experience taught me was that my intuition was right, and that the actual research that allows these drugs to enter the market is so poor that I think if no one should be, people would be shocked if they knew how poor the research was. I mean, they're just the trials are so short. Nothing has been studied longer than a year. We park people on these drugs for a very long time. Multiple of these medications make people worse in the long run. And so I'm learning all of this, and then I also discover that when patients try and come off these medications, if they do it too quickly, a small fraction of them develop literal brain damage. And so because I'm so ingrained in this space of psychiatric research, I look back and I realize me and a lot of my colleagues had actually been hurting patients. We'd been putting them on drugs that don't work, that wear off after time. We were pulling them off too quickly, and the tapers were failing. We would, and then, some of them, we were just hurting them. So all of this kind of landed on me, and I said, this is the way we're practicing is wrong. And so I started a clinic to help get people off these drugs safely.
I have I have a million questions after that. So just bear with me here because there is so much to pull apart there. I think our listeners who are predominantly American and over 80% are men. And a lot of these guys are combat veterans, like including myself. And we have all been put on pharmaceutical intervention in place of genuine community support, healing, and looking at other non-FDA approved solutions towards depression management and otherwise. So let's get right into a couple things that you stated. You worked for the pharmaceutical industry. You went to the FDA. You went back to the pharmaceutical industry. A couple things. Number one, is that not a conflict of interest? Am I losing my mind? Or how did you get into the pharmaceutical industry? Was that always the play that you wanted to be in originally?
So, starting out, going from the FDA to the pharmaceutical industry is a complete conflict of interest, because that's why the pharmaceutical industry hires people from the FDA. They want people on their team who can tell them how things work over there. They want someone to say, hey, I noticed this medical officer in the FDA is reviewing our application. How does he look at things like this? What are his pet issues? And so that relationship is really valuable. And also they like having former FDA people on their team. So when, we go and put the applications into the agency, they can say, oh, it's Josef. I know Josef over there. He's the safety guy on this thing. He's really nice. When we had a cancer scare in my family, he was sitting there holding my hand saying, you're going to get through this. It's okay. And so the two fields become really enmeshed. And so one, you get all this insider knowledge about how things work on the inside, and then they also leverage the relationships. Now, money is involved in this as well. So when I was at the FDA... Of
course, this is why I was bringing it up.
Yeah. When I was at the FDA, I was making around $160,000. It's a decent salary, but it isn't compared to what you would make in clinical medicine in the US. That might be like $300,000. Right. When I went to the pharmaceutical industry, the total compensation package, if I added all of the stocks and options and everything, it was about $700,000. So that is a juicy carrot to dangle in front of a drug regulator to say, well, hey, can you be kind of flexible, morally, with how you do things? Because we have this $700,000 pay packet here. Think of all the things that could do for you and your family and all of that. And so there's a enormous financial incentive to do that. And that's why you get this, what they call it's the revolving door. And it's not just in the pharmaceutical industry, it's with any government job where the government regulates an industry, and that industry, they want to lure people into it.
Yeah, we see a very similar thing in the military industrial complex with combat veterans switching over to industry and vice versa. Whether you go from a military contractor over to a civilian position at something like Lockheed Martin, there's ways that you move and you shift, right? So any industry that feeds another is always going to be susceptible to manipulation in some way, shape, or form. But when it comes to drugs like this, how long did you work in the industry before you started to really start to feel the morality issue weigh on you? Because these were drugs that are not just going into adults that are what I would consider consenting adults. The majority of individuals taking, whether it's birth control, SSRIs or others, we aren't ever truly told the repercussions of long-term use.
Yeah. So it took me about 3 years, industry plus FDA together. And you go through this stage where you're like, can I be morally flexible and be okay with this? It's like being a lawyer for a criminal who was, charged with murder. And there's the case that, hey, everyone deserves representation, and that's fair. And that's the law. And, even if you do something wrong, you should have someone there to defend you. But I found that when I was in industry, like, their incentive is to mislead, because what they want to do is they want to present their drugs in the best possible light. And you can say to yourself for a while, well, I'm meant to be presenting this drug in the best possible light to the full, push it into the gray area to the extent of the law that I can possibly get away with. And that's okay, because someone's always going to do this job. And, there's doctors and there's regulators, and it's their job to kind of pull us back. But eventually it dawns on you that this is just hurting people, that those
Mm.
agencies and those people, they cannot do it. And so I think there is something uniquely different about healthcare that makes the kind of moral flexibility about, you know, working in the pharmaceutical industry, especially if it's like with suspect drugs and they're doing, bad things, that is wrong. Because when you're dealing with healthcare, it's not, I don't know. I think it's a lot worse than, I don't know, banking or oil. I mean, you could say those things are bad, but we're talking about, people going to their doctors in their weakest moment, wanting accurate
Mhm.
information about drugs, and your job is kind of to mislead the doctors.
Right. And we have this. This is not the only industry in the pharmaceutical world that we see this in. I live in Canada. We see this with Canada's euthanasia kits, right? We have the same conversation. These drugs are not FDA approved. These drugs actually cause paralysis in your lungs to fill and you drown to death. They're not a peaceful death, but marketing overrides the truth in a lot of different areas when it comes to our wellness and even end of life. So I want to break down a little bit, once you made that decision, how was it that you came to the conclusion to start an entire clinic based on removing these from people's bodies? And how did you come to that conclusion that this is what you were going to do next with your life's work?
So I'm trying to put together, it really comes back to that moment when you sit there and just go, gosh, I can't do this job anymore. This just
Right.
feels wrong inherently in my gut. And then
Mm-hmm.
you do some soul searching and you go, what could I do that I would feel okay with myself? And I looked at
Mm-hmm.
psychiatry and I can't practice bread and butter psychiatry anymore. The drugs are wearing off over time. They're making people worse. And so I started to think the only place I could actually be at home within my profession is if I was helping people recover from side effects and safely come off the drugs. Um, and a few things happened simultaneously. While I was working in the FDA, I was blogging and writing about this as well. It's particularly problems with psychiatric medications, and people were reaching out to me as someone who, oh wow, this guy's talking about withdrawal harm. I've never seen a doctor discuss that before, and so people started
Mm-hmm.
to reach out to me, and I realized I really loved working with these people who they were saying, the drugs aren't working for me anymore. Help me find a way to deal with my symptoms without the drugs so I can safely come off. And I just loved the idea of working with people who had that mentality of, I don't need this anymore. I'm not broken. And I need someone just to help me find a safe way off. And we're going to replace this with non-drug alternatives. And that just, I love working with those patients. They're so
Mm-hmm.
uplifting and brave. And so after working with a couple of them, I was like, this is what I want to do for the rest of my life.
I think I mean, that's brilliant. I wish more people were not motivated by finances and more motivated by morality, but I'm optimistic that will start to shift when we have individuals like you speak out about your stories. And I want to get a little bit more into some of the conversations around SSRIs, specifically because, like I said, they are one of the most prescribed drugs in our country and in your country. And we are putting young people on these drugs. So can you explain to me, you had stated, SSRIs are tested very, like in a very minute amount. So can you walk me through what a short-term test would look like, or how did they do these tests that these people end up being on these drugs for a decade plus, what this is going to do to their system?
Sure. So for an SSRI to enter the market, they go through a 3-month clinical trial. And so they get a group of people, they put them on the drug, and a group of people, and they put them on a pill called a placebo, which is just like a sugar pill. There's nothing in there. Now,
Mm-hmm.
and then they give them the drug and they look at what happens after 3 months. Now, what these drugs do is, and they measure it with like a depression scale, and they say, well, did the
Mm-hmm.
group on the drug perform better than the group not on the drug? And um, the people who get the drug, they do lower the scores on the depression rating scale. It's a small amount, but that's what they do. And these drugs have an effect where they're emotionally constricting or numbing, if you will.
Yes.
And that's the drug effect. So, but what?
Can I?
Sure.
Sorry, not to interject, but can I just ask a question here that pertains to that? When you're looking at an individual that is verbalizing and they're testing this way and they're saying, oh, I'm feeling an antidepressant effect from this test, are they then also looking at outside contributing factors and outside stressors, i.e. physical movement, diet, you are the sum of the five, and those are not contributing factors at all. So you're saying that they're running a test where this individual could very much just have started to work out consistently all around the same time that they're doing the test, and they're not looking at those outside factors whatsoever.
Yeah, those factors aren't even considered. They're not measured for. They're not. And so they're just looking at the two groups. The only thing that's different between them is whether they get the drug or not. Now, there's something really important that I want people to remember about this. They are not looking at real outcomes, okay? And what I mean by that is lowering your symptoms on a depression score. That means something, but there's other things that are really important when you're using medications like this. This is, how are your relationships? Are you employed? Tell me about the quality of your life. These are like kind of the real outcomes that people would care about. None of that is measured. And so people hear antidepressant and they think, oh, this is just going to fix my life and, everything is good. Yeah. No, the research just shows that this blunting effect will lower your symptoms of depression and anxiety slightly above the group that gets the placebo. Now, that's all well and good because there's actually a lot of different opinions about SSRIs. You will see online and you will meet people who say, these drugs, they saved my life. I was in despair, right. I was anxious, and they really helped. And it is true. They can do that. If you're in a pit of despair and your thoughts are out of control, getting on one of these numbing medications will pull you out of that. And people will say that can be life-saving. The issue with these medications is that there is not a single study out there that has gone longer than a year that has done a placebo control to see whether these drugs are effective long-term. And what you see in clinical practice is that after 6 months or 12 months, the drug wears off, you need a higher dose. And then you need a higher dose. And then within 2 to 5 years, they're maxed out. The drug's hardly doing anything anymore. And then they get on another drug and so on and so forth. So a lot of people are being told, hey, these medications are safe and effective. Well, effective means they just kind of blunt you out a little bit. And, and it's also only for that 12 weeks or so that they were studied for. We have no idea what's happening to people long term. And half of the Americans taking them have been on them for 5 years or longer. And so, I mean, that's the evidence base. And most people don't know that. They assume that they've been studied for a very long period of time and that they improve real world outcomes like employment and relationship and all that. I don't think they do any of that.
As an individual who was on one for a 10-year period, I can tell you they do irreparable damage to things like libido, community, ability to function, sleep, diet, you name it. They don't actually do what they say. Now, you are right. I will give you that. There is a triage situation where I believe every medication has a purpose, but it is a temporary one, and it is not to be a long-term. We have seen significant evidence around traumatic brain injuries and the erosion of gut health through things like over pharmaceutical intervention on combat veterans who have been on them. And that is just one of the biggest things we see when it comes to traumatic brain injury is the more drugs you're on, the harder it is because we see the cart being put before the horse. And with things like post-traumatic stress disorder, 11 of the 13 symptoms overlap. So it's very hard to diagnose an individual when we're not necessarily looking at the actual contributing factors rather than just slapping intervention on top of it.
That gets to the heart of the main problem with mental health these days. And that is that people get put on the drugs and they get told that this is a solution to your problems. And it's not, and it doesn't work long term. The only time it ever makes sense to use the medications like the SSRIs is when they're being used in conjunction with a plan to address the root cause. And so, relationship problems, work problems, serious health issues going on. But that's not how they're being used. These are being handed out in 5 to 10 minute visits with psychiatrists and family medicine doctors. People are being told that, you have a brain illness, or they say something very vague like, well, we don't really know, could be genetic, could be other things, but this is safe and effective, just take it. and then they follow up with that person every 2 to 3 months, and they're just parked on the drug, and there is zero effort or interest in helping them find a non-drug and more sustainable solution to their problems. Because remember what I said before, these drugs, they wear off over time. This is not a long-term effective solution for people. It doesn't make sense. And people, and I mean, that's why we're in a big mental health crisis now, and people aren't.
Yes, we are.
People aren't getting better.
No, they're not. And there's a lot of evidence to look at that with things like, I go back to this because this is a very, very correlated issue we're having with, which is medical assistance in dying, and opening that up to the mentally ill starting in 2027 in Canada. Your states are currently doing it under the eyes of the citizens, and most Americans are not aware that there are 10 states and one jurisdiction euthanizing its population currently, and are about to explode in the next 18 months. And that's because we have a mental health epidemic. We have a mental health crisis that is going on. And that's not to use emotive language. That's just the reality of what we are seeing. We've never had so many drugs like this prescribed. That could be coming from several different contributing factors. You could have TikTok influencers joking around about popping candies like it's not a big deal. And then you have real, true people who have gone through real traumas in their life, who have been sold a lie by a doctor who's getting paid out the back door by a pharmaceutical company to be pushing these drugs, and higher doses at that on individuals. And one of the things we are seeing, at least in our communities, police officers, fire, paramedic, people who are going through compounding trauma over and over and over. I have a very dear friend that was actually offered, due to her hormone imbalances after children, not because of depression, due to her imbalances, they wouldn't test her for they won't run in Canada. They won't run blood work on females' hormones or testosterone levels, but they were within a 10-minute. We're going to put her on an SSRI, and I threatened her life if she did that, so she didn't do it. So the point is she understood that there's a long-term repercussion. Sometimes you have to grab your friends and shake them a little bit. But I'm curious about this because you've talked about, how we're overprescribing, which is a very clear outcome based on what we're seeing. We're seeing suicide skyrocket through the roof. Women are 2 times more likely. Combat veteran females are 4 times more likely. And we're at a ballpark of anywhere between 22 and 44 suicides a day in America in the veteran community alone. And that's not including people that are actually being put on record as a suicide. Those are just the ones that are being reported. And a lot of those individuals are medicated. So can you talk to me a little bit about anybody who's taken an SSRI, the dosage levels, what could that actually do as an adverse effect towards an individual who is going through, not even withdrawal yet, they're just on the medication, but the lovely side effects they read off on the side of the bottle. What are the real repercussions of this?
So I'll go I'm going to answer it in this way. So
okay.
I think the biggest side effect of taking these medications is often the opportunity cost. And that is when you take them and someone tells you that this is the solution to your problem. Don't look at the other areas of your life, do this, because what actually ends up making them worse are the unresolved problems in their life, whether it's health issues that are going unaddressed or relational problems or work problems. Those problems, they fester and they get worse. That is the number one side effect of taking these medications. Outside of that, you can point to a few nuanced things. I mean, these are emotionally blunting. They can disconnect you from other people. I think they can have relationship effects that are quite obvious when you lose your ability to intuit what other people are feeling. And the other issues are, particularly in young people, they can have paradoxical reactions. And so instead of them having this expected numbing effect, some people actually become more suicidal. And this is not like a benign effect. I mean, it has been shown in the clinical trials that if you're under age 25 and you take one of these drugs, you are more likely than the people who were given the placebo medication to have a suicide attempt. Now, I want that to sink in for a second. It makes no sense to give these drugs to people under age 25 because who really cares if they lower depression symptom scores if, on average, more people who get the drug than those who don't go on to engage in suicidal behavior. And so that is just, and that's because of the paradoxical effects where some people just get worse. And we have to mention the metabolic problems as well. the weight gain and the self-esteem issues that go along with being unable, being not looking like yourself.
Mm-hmm.
And then, I mean, the other major things which most people know me about is the horror of withdrawal when people eventually try and come off.
And I do want to get into the withdrawal, but I have a couple more questions around individuals, especially females taking SSRIs, because there are in our world, in my world, there are male and female, and women have children, and children are susceptible to damage when in utero, when a mother is on a pharmaceutical like this. And I, number one, don't think it's been tested with women who are pregnant, which I'm probably right on. But then also the long-term effects of what happens being on a SSRI when going through a pregnancy and what the risks are to an individual and the fetus and once the baby is born.
So I can speak to that. So I was just down in Washington, D.C. at the FDA. We were invited to be experts on a panel to talk about this by the commissioner's office. And the data is concerning. For a long time, doctors have been telling women, well, the evidence about, the risks of problems in the children exposed in utero, it's not settled yet, but we know the risk of depression is real, so we should probably treat you anyway. Right now, there are 12 MRI studies, different studies, not one study with 12 people, 12 different MRI studies that are comparing the brains of newborns who were exposed and are not exposed to SSRIs. And they have all found structural changes in the brain. On top of that, when we've done controlled trials, placebo-controlled studies in mice, the mice who are exposed in utero to the antidepressant, they grow up and they display more autistic-like behaviors and they engage in less sexual activity. And so,
whoa,
there are, another study was done where they took older adolescent humans, and they compared a group who had been exposed in utero to a group who had not been exposed, and they found that there was altered fear processing in the amygdala that correlated with worse mental health outcomes. And so how this might end up showing up is, kids who are more anxious because of being exposed. Now, so I also the data on that is concerning, but I also want to dampen it down. I know many people who are exposed to these medications, in utero, and a lot, and they're fine. And so we don't know how much of an effect this is, but it's definitely doing something. And so, and many women aren't even told about all of this evidence, and so that's what we're doing down in DC. And the hardest thing about this is there's so many young women that get put on this, in their teens or early 20s, and then they decide that they want to have kids, and they can't just come off like immediately. Sometimes it takes a year or two to get off these medications if you want to conceive drug-free. And it's when they find out that it's this big ordeal, they're very unhappy.
Well, it's a significant, I speak to myself because it's my own lived experience, but I was on 150 milligrams of Zoloft while I was pregnant, and I was not advised about any of it. I sat with Children's Hospital in Vancouver having these conversations, and they, at a children's hospital, put my needs above a child, which, again, that's not a surprise because they also do gender manipulation and mutilation there too. So it's not a shock to me. But when I look at SSRIs for an individual going through a mental health crisis or issue like that, I would like to be more clear with mothers and give them more advice. But again, it's no different with birth control. We were not told that it's a Schedule 1 carcinogenic until after, taking it for 20 years and wondering why. So it's not a surprise to me that we're seeing that. Now, I have a 9-year-old incredibly healthy son, which I would consider to be a normal, active, wild little boy. But that being said, we don't always know the long-term effects of something till these kids hit later on in life. The only thing you can do is really surround them with the right network and the right support when and or if something happens. But I agree, it's one thing to bring up the truth, but there's nothing wrong with saying the hard, uncomfortable truth that the testing is concerning, and it's not about fear mongering. It's about giving people a dose of reality that when you put something in your body, it's going to have a long-term effect.
Yeah. And there's uncertainty here. I mean, it's very likely that there's some very robust kids, or just genetically they're not as affected by the exposure, and there could be some kids who are more affected.
Right.
And sometimes depression is so severe that, you know, even if the mom's making a decision for her and the child, it's a matter of life and death. But the thing is, women need to know about the studies and the uncertainty, because you're like, let's say something does happen later on, you can make a lot more peace with it if you were able to consider that decision at the time, and you talk amongst your family and your loved ones, and you say, this is really what we need to do right now. We understand the risks, and we've got to keep mom safe. And if that's the case, then that's all right. But women are being robbed of that opportunity to even make an informed decision for their baby.
Well, 100%. And this is one of the reasons I was so keen to have you on, because there are a lot of different areas here where individuals will find power in understanding. When people are given information, they then are given the tools to be able to make decisions clearly on their own, and then weigh the pros and cons for themselves, rather than being fed a lie. So talk to me about this idea of depression's not coming back, it's withdrawal.
So there was, I mean, there has been a lie that has been shared by doctors for over 3 decades, which is finally being uncovered. Now, when these drugs initially hit the market in a major way in the early 90s, I'm talking about the SSRIs, a lot of doctors came forward and said, hey, we're having problems with withdrawal. And the drug companies making them went into PR, damage control mode, and they convened a group of academic consultants to essentially say in a white paper that, from their experience, antidepressant withdrawal is mild and goes away in 2 weeks. And
sorry.
Yeah. So, and these are people from Yale and Harvard and UCLA and all of the top institutions around the place who had helped run these clinical studies. Well, it turns out they were basing those conclusions off the patients in those 12-week studies. And, obviously you're not going to have a lot of severe withdrawal problems if someone's brain has only become dependent on it in, a couple of months. Now, that, drug reps armed with that information and that white paper went out and they gave it to family medicine doctors and psychiatrists, and, they spoke at conferences and medical schools, and that is what took hold. These drugs are mild and self-limiting. The withdrawal is mild and self-limiting, and it's not really that big of a deal. You just kind of, drop down a dose, every couple of weeks, and then you stop it. Boy, is that not the case. And this is, this is a space where a bit of nuance is needed. But researchers out of the University College London ended up doing a survey of representative patients who had been on the drugs for 2 years or more. And they found that 80% of people had withdrawal, 45% of them said it was severe, 40% of people said it got in the way of them being able to come off. And so this is not a mild problem. And if I can speak from experience, here's what I see. If someone has been on these drugs for over 2 years, I would say maybe half of the people can come off pretty quickly and they're okay. Their brains are quite elastic. They go through a 2 to 3 month period where they suffer a lot and they get through it. I don't know why some people tolerate that well, but the other half of people, their brains are not that elastic. And when you try and pull them off in that way, where you just kind of taper them in 2 to 3 months, they totally crash. They develop severe withdrawal symptoms, dizziness, brain zaps, and severe anxiety and depression. And the doctors looking at these patients say, well, I was told this was mild and would go away quickly. So this obviously isn't withdrawal. This is your underlying condition. This is proof that you need the drug. And so they would convince the patients that, hey, this is just proof you need to stay on it forever. There's something wrong with you. Your brain is broken. but those patients actually could have come off the medications if they had done it in a much slower, gradual way.
So when what we're seeing here too, and I'm so glad that you're bringing this up, because like I've been, told by several different psychiatrists, I will put you on the drugs. I will not take you off of the drugs. It's too much of a suicide risk. The idea that people can't come off of this, I think, is a falsehood that has been perpetuated just for money. But we've seen other types of drugs where individuals, while going off of them, have become so hyper-suicidal, they've actually applied and qualified for euthanasia under the title of akathisia. And the reason I bring that one up is there is obviously the famous case of Jordan Peterson going through that process and speaking about that publicly. But I've also gone through that individually with a person who was qualified for euthanasia because of akathisia over a Zoom call without a medical check. And we got that stopped in the 11th hour here in British Columbia before Dr. Ellen Wiebe could, as she has to so many other, wrongfully kill an individual, allegedly. So, we've seen this before where akathisia is a real concerning issue. And there are several unregulated websites where people talk about this, where these individuals have been told the only way to get through akathisia, sexual dysfunction, or cognitive decline is to kill yourself and to go use the medical system to do so. So can you talk to me a little bit about that? Because this is one that I'm hearing way too often.
Yeah. So I've come across this a lot as well in my own practice. So there is a fraction of people who, when they come off these medications too quickly, they develop a condition called protracted withdrawal. This sounds kind of benign, say, oh, you're just in withdrawal, just jump back on the drug again and it'll go away. That's not the case. So for some people, when they come off the drug too quickly, that electrical storm that causes the withdrawal symptoms can actually damage the brain. And so these people, they end up having severe anxiety, cognitive impairment, ringing in their ears, light sensitivity, gastrointestinal problems. They become severely constipated. Their hands and feet burn. They have had a global neurological injury. And they also, as a part of that, they develop a condition called akathisia, where they can pace for hours every day without being able to stop. It really is living hell. There is no escape from this. You can't just go back on the drug and it goes away. It's like you've had a traumatic brain injury. Someone's pushed you out of a window. You've hit your head. The only thing that I've seen make this get better is really time. And thankfully, I would say the majority of people do recover within 2 years, but there are always cases where people are very unwell for many years afterwards. And that level of suffering often leads them to say, you know what, it's not worth it anymore. And I want to go and, seek out physician-assisted suicide. I know you mentioned PSSD. That's also a severe side effect that some people get from antidepressants, where they develop enduring sexual dysfunction that does not go away, along with cognitive impairment and mood blunting. Many people seek out physician-assisted suicide for that as well. And yes, I mean, these are conditions that are so severe that they really drive people to want to end their lives.
How do you get through to an individual going through such a severe, because these individuals are not, they're not faking it, they're not lying about it, because you have seen the data, you understand the research, you understand the testing, which I think is one of the biggest pieces most physicians are unwilling to look at, which is the lack of evidence to show this is a way to improve people's lives, when we understand that things like physical movement, diet, and your community and purpose is such I would argue, a massive contributing factor over taking a pharmaceutical drug that can absolutely change the outcomes of somebody's mental well-being. So how do you work with people like this to get them through that process and even get them to hear you when they're in that level of pain?
It's one of the hardest things you'll ever do. And this is most of my practice. I would say half of my practice are people with neurological injuries from psychiatric drugs. So I'm very familiar with this area. I don't think diet and exercise are really going to cause substantial improvement. I think they always make people feel better because just generally being healthy, whether you're sick or you're well, will kind of improve that. But in the patients that I've seen who are really sick like that, they just need a lot of reassurance and they need a lot of support, and you have to carry them across the finish line. And sometimes that just looks like giving them reassurance every day and just begging them not to take their lives and having uncomfortable conversations about physician assisted suicide. And, it's, there's no, when you work with people who have had severe injuries like this, where it's very uncertain, you don't know if they're going to get better, there's no real textbook for it. I found myself having a lot of these conversations with patients where I'm saying, well, we're going to have to talk about it because I know if I just tell them, hey, listen, I'm never going to support this. I don't want you to die. They're going to find a way to do it anyway. And then their family is going to find them later. And so I just try and stall almost like a plane has been hijacked. And I'm just, anything I could possibly say to keep them going like another month or two, because I know if I can keep people hanging on long enough, the brain has a tremendous capacity to heal. And that's what I see. I see that these people get better gradually over time. And so I reassure and I stall and I do everything I can just to keep them going. But it's really messy work. Yeah.
Well, I mean, it is very messy work. There is a lot of individuals who want a quick fix more than we've ever seen in anything in modern history, between things like Ozempic, SSRIs, all the quick fixes that you can get to kind of move through lifestyle changes that are going to require significant amount of support. But unfortunately, whether it's due to lack of funding, lack of access, lack of just general want and need to say the hard thing out loud, people aren't getting the support that they need. So what do you suggest for those people that maybe aren't located near you or don't have the right insurance or doctors or people around them to really walk them through this process?
It's very sad because these conditions aren't even recognized by most doctors. So insurance doesn't even really play that much of a role. And most of these patients, I tell them to connect with one another online. I mean, there's places like survivingantidepressants.com or the countless Facebook groups, because in many ways these patients, they are on their own. Yes, there are clinics like mine, but we work with a small group of people and we're only in certain states. But most people are going through this on their own because these are not well recognized conditions.
What do you suggest for individuals if they have those around them that are not supporting the idea of going off SSRIs? Because we do see this, right, where family members, there's a depression in the family. A woman has just had a baby. She's going through postpartum, maybe is struggling, and she wants to, or another individual wants to broach the conversation to loved ones that this stuff is not working for me anymore. I don't feel well. I'm not doing well. I do see a lot of clients come to me who say individuals don't want me to get off it because they're more worried about me regressing or killing myself or not being well. How do you fight or combat those conversations?
I often feel like the family members, they're probably coming from a serious place. I mean, usually the reasons that people get on these drugs are terrifying. That people have become completely disabled or suicidal. And sometimes when they've tried to come off in the past, it's completely turned their life upside down. And so it makes a lot of sense that family members are going to be hesitant about this. I try and, it could be really helpful to have a third, an extra person in there. So whether it's, someone like myself, because you have to acknowledge those feelings. You could say, well, this is why it went so poorly last time. The taper was too quick. And, if we can do the taper in a way that's much more slower and we can support this person, I think we could actually get it done safer. And if things are going off the track, we're going to catch them quickly and we'll reintroduce it. I think their concerns need to be heard. And so a lot of it comes down to finding out why they're so worried and then putting together a plan that addresses their concerns. So, because the best way to do this work is with all of your loved ones are holding hands with you and they're just saying, you know what, we support you doing this. and we feel safe with the plan. It's much harder when it's like so fractured like that.
With so few doctors like you, how do you see yourself and others combating systematic medical gaslighting? Because it feels like it is the most prevalent it has ever been in modern history.
So I mean, I do a few things. Like I have the YouTube channel, which we have like 100. I think we have like 10 million people who tune in per year, which is a great way just for education. I mean, we publish, for clinicians out there, we publish all of our internal trainings, the trainings I use for my team. And so we got people all around the world using our tapering practices. And I teach. And so, I go and I teach nurse practitioners and doctors how to taper. And, there's people like me, there's people like Mark Horowitz out there. And so there's a few of us. I mean, we need help, but if you get a couple doctors out there who are really passionate about this, you can make a big impact in just sharing the knowledge with clinicians and also directly to patients through social media. Your shows like this help a lot, Kelsi. Yeah, these shows are great for that.
I mean, we've been doing it for 5 years for a reason, my friend.
Yeah.
That's how it works. What's one thing you would tell somebody, though, if they were wanting or they were toying with the thought or the idea of, hey, you know what? I've been on this. I've done everything I can. I'm feeling ready to go off of it. What would be the first thing you would suggest to somebody just to get the process started?
So you need a plan. This is not something that you want to kind of, stumble into. I would suggest learning about tapering. I'm going to suggest my YouTube channel because that's a place where we make very digestible content. You want to have some understanding of what that process looks like. Don't go into it blind. I also have I have a video on my channel called How to Find Help, which goes through the 3 major directories for doctors just like myself who are more knowledgeable about tapering and holistic approaches to mental health. Grab a doctor off that list if you can find one local, because that way you don't have to, I still think you need to learn about it, but they're going to bring their own expertise to it as well. And so I think those are the 2 things that I would do. Find someone qualified to help you and make sure you do your own homework on what a safe taper looks like.
What's the worst case of SSRI withdrawal you've ever seen?
I would say, I've seen completely functional people, professionals, move back in with their parents and become disabled for several years. And I've seen people sign up with places in Belgium and all of that for physician-assisted suicide. Thankfully, some of them haven't gone through it. I've personally worked with several patients who have taken their life from protracted withdrawal and left behind families and children. These are problems that absolutely destroy people's lives. They can be that bad.
How do you handle it? Because it's a lot of weight to carry, to have a patient, to have a client, to have an individual that you've been working with, that you've cared for, that you become invested in. Like you said, you do your best, you hijack the plane, you try to hold out, because a lot of times if we can just get to the next day, it can start again, we can get to the next week, we can get better. How do you handle this?
It got a lot easier when I had a team of people doing this, because I think carrying all of that on your own becomes very hard. Just having colleagues that are managing the case with me. So, we have a very hands-on practice, and so we know the families really well when this stuff when this stuff happens. And I don't think anything really prepares you for it. You just move through it, and but yeah, I think about these patients all the time, and I think about their children and all of it. It's I don't really have an answer for that, honestly. Me and my team, we lean on each other a lot.
That's a great thing to hear, though, because it takes
Yeah.
a team to be able to manage these losses, right? Nobody will ever
Yeah.
be able to fill the void when somebody takes their life for whatever the reason is. And so, whether that's the doctors or the families around them.
Yeah.
So, this is a hard one because I know it's an uncomfortable one. But do you believe with modern psychiatry, is it broken?
Absolutely. 100%.
How do we fix it? What do we do? Because it feels like I know there's hope, but the way the physicians are being trained, I'm concerned.
I think the way to fix it is, I mean, we have to talk openly about the problems, and people need, as uncomfortable as it is, I think people need to hear that, we have a system that's really designed to hand out drugs in a very transactional way. That if you're relying on doctors to help you with your mental health, the solution is often going to come in a pill, and that the things that are causing these problems, they're really up to you to fix a lot of the times. A doctor is not going to be able to cure your loneliness or help you with a bad relationship or an abusive one, and find out why that pattern keeps on going on. You may need to figure that out on your own, or seek out a therapist who can give you some insights in getting through that. Your family doctor is not going to be able to say, hey, why are you working in this job where there's no meaning and you don't like it and it's just a 40-hour drain on your battery? They're not going to be able to sit down with you and troubleshoot, like, what do you pivot to? Do you go back to school? Do you start new somewhere else? I mean, these are some of the most complicated, difficult problems that people ever face in their life. They cannot be fixed by a pill. And then we got to talk about the health issues as well. So many people, they don't get enough sleep. They're not moving their bodies. They're eating food that doesn't nourish them. I mean, this stuff is so easier said than done. To actually work one-on-one with someone and just say, well, do you see how food has become an emotional crutch for you? And that's what's driving the problematic eating. Do you see how you're really abusing cannabis, or you're using too many nicotine products or caffeine, and that's really throwing you off? People don't like hearing this stuff. This is all very difficult, complicated stuff, but that's really the solution. If I was to boil down mental health into three concrete things, which are very hard, it's fix your relationships, find work that you think is meaningful, and then look after your health. If people are able to do those three things, 99% of them do not need to be on psychiatric medications.
It is the one thing I've learned from being in, how many years has it been now? I think 13 years of weekly psychiatry appointments with a doctor who did not give up on me like the rest of them did, is that if you do not find purpose, you do not find community, you do not sleep, you do not drink water, you do not move your body, you do not love your life or those around you, it's going to have a contributing factor. If you're constantly watching trash TV and surrounding yourself with people that want to see you crash and burn and drink and be unhealthy, it's a no wonder that we are living in a digital age where communities are only online, which to me, I understand not everybody has access to individuals. I mean, when I look at my network, I'm sure now when you look at your network, we're not all in one country, let alone one state, let alone one province. So community feels like, online community feels like an oxymoron, but sometimes it's all we have to get ourselves started and to get ourselves moving. So if you were having anybody that you know, or any of my listeners watching this right now, and they feel like they are going absolutely insane after trying to quit one, not being successful, trying to quit one, and just feeling horrible, what would be one thing you want them to know?
So these are problems that can be solved, is what I would want you to know. Like, coming off the drugs is just a technical thing. You can learn that, or you can find someone to put together a safe taper for you. It's the stuff that comes before that, because if that drug is really there because there is a lot of problems in your life, you got to address those. And I generally tell people, if you're looking at your life and you're just like, the whole thing is chaotic, start with your health. Like, if you want just a very direct thing, before you look at your relationships or your career or your meaning, just get physically healthy first. A lot of the other stuff becomes easier. After you get physically healthy, look at the things going on in your life. Are my relationships more important? Is the loneliness more important to address, or is it the work? Then just pick up that one. Find experts or people that you trust who can break down these complicated issues into tiny step-by-step morsels so you don't feel overwhelmed. Most people don't do anything because they just go, the size of the problem is too big. How could I ever figure it out? And it seems like that. But this is a big world. There's like 7 billion people out there. People have gone through what you've gone through. There are experts out there. There are coaches. There are people that are really passionate about the problems that you're having. If you can find some of them that you trust, they can give you the step 1, step 2, step 3, and just give yourself a lot of time, and you will come out of it.
I have one last question for you, and this is a personal one. This is more just from me and not viewers or anybody else. But do you feel like there's been a point in your life that brought you to here? Were you ever struggling at some point in your life where you weren't necessarily on an SSRI, but you were feeling lower like this? Because to be honest with you, as somebody who does not a doctor side of what you do, I'm driven by somebody helped me. Somebody pulled me and grabbed me when I was drowning, and it took the right person. But it feels like you have the same type of passion. So where does that come from?
So the honest answer is, I've had experiences on medications. I've taken Zoloft for a short period of time, mainly to see what it was like. I know what it's like. I took Xanax for about 6 months after my daughter was born, and I was totally burnt out. And I realized it was making me worse, and I kind of sorted out my life, and I came off the meds, and I stopped drinking coffee and nicotine, and I sorted out my health, and that made me better. I could say those things played a pivotal role in shaping how I look at things. But really, at its heart, I wouldn't identify myself as someone who really suffered with these issues the same way that the people that I help do. At its heart, I think I'm someone that really hates liars, because the thing that gets under my skin is when people lie to you or people mislead you. And that has always been, I think, the thread for me that I've followed, wanting to understand, all of the deception and, why seemingly good people, because we all know someone who works for the pharmaceutical industry and these different things, how they can get to a place where they can hurt people. And so that was, I don't know what it is about me, but it's been something that has really driven me.
Yeah, I can see, I know we're across screens, but I can see very clearly that you were very motivated personally, emotionally, morally, that this is something that you take incredibly seriously, and not only just leaving a legacy, but you don't want to hurt anybody else. Is there any part of you, and this might be too personal, so please, you can tell me to just not, but is there any part of you that feels like you're atoning for the time in the pharmaceutical industry?
I wouldn't say, when I was in the pharmaceutical industry, I mean, I was already, I would say, pushing back against a lot of the deception. I'd have experiences where I'd say, I think we should say this about the drug, and I think we should publish this manuscript about the safety issues. And we'd have higher ups just shut it down and just say, hey, we don't really need to do that. We're going to make a bigger deal of this than it is. And so we're just not. And so even when I was there, I still was pushing. I would say I feel like I'm, in a way, atoning for how I practiced earlier in my career before I knew these things. Because there are, like I said, there's hundreds of people out there I've put on these, probably thousands, who I put on these drugs and told them it was a chemical imbalance and that it was safe and effective. And I don't know what's going on now, but a good chance of them probably went to other doctors and they continued prescribing them, and they've slowly gotten worse over time, and now they can't get off because of withdrawal.
So it's safe to say that you regret writing some of those prescriptions.
Oh yeah.
That's heavy, my friend.
Yeah, but I think you got to start somewhere. I mean, I think, yeah, I think that this might be one of the reasons why change is so hard, because it's uncomfortable for doctors out there to be like, you know what, I think I might have been harming people. And, you know, I could say, you know, I didn't know any better, but I was still the one writing the scripts.
Right. But, you know, forgiveness is one thing, but when you spend the rest of your life doing the opposite of what you did, I think that you're going to be not only more than forgiven, but you're going to end up saving more lives than you ever would have hurt. So in my opinion, it is so much better late than never. And I am very grateful that you gave us your time, because the amount of people that I can guarantee will be calling you after this, so I do apologize in advance, the amount of people that you've just given hope to by showing that you don't have to follow the status quo. You don't have to be those doctors. You also don't have to be the people that just believe everything that is told to you by your doctor. You can ask the hard questions and be ready for change. It's powerful, my friend. And I'm very grateful for your time today.
Thank you so much for having me, and this a very deep and pointed conversation. It was a pleasure talking to you.
Well, my friend, you are welcome anytime. But before we go, I really do want people to be able to access the resources that you do provide, even if they are not in America. And we will drive them in the bio as well. But can you tell everyone how they can not only get access to you, but maybe learn from your YouTube, learn from some of those doctors that are around you in your community? And not only that, just support you as a human who's decided to do the right thing.
Yeah, so best place to find me on social media, and we're on all channels, but the biggest one is the YouTube channel by far. So it's Dr. Yseph, and that's Joseph. Underneath all of the newer videos in the description, right at the top, is our free drug tapering course. It's everything that I've learned about drug tapering. It's absolutely free. You can use it with your own doctor. If you need help, search the YouTube channel for how to find help. It goes through all of the directories for doctors all around the world, not just in the US, and hopefully you can find someone there. If you're particularly interested in working with me and my team, my website is taperclinic.com. That's TAPER, like a drug taper. So taperclinic.com. And you can see the states I work in. We work in the 14 most populous US states.
Well, I was going to make a comment, but I don't need to take it any further from there. But that's absolutely wonderful. We'll put everything in the show notes, and I am hopeful that people will get some relief. I only wish I knew you when I was going through my tapering process. It probably would have been a lot less painful than it was for me. But in saying that, everyone, before we go, please go do yourself a favor. You know that we only work with companies and people, and only have individuals on the show that we can trust. That's Good Living, Ketone IQ, and that's Row Nutrition. If you're going to look after yourself, you might as well start here, and we will see you all next week.